So I actually am going to take a step back and talk to you guys more about the framework that we have at the National Pork Board, and tying back to what we talked about earlier in terms of those scientific advances as well as communicating that science to the public. And so as the title suggests, really, again, taking that big step back and giving you an overarching view of what we do in the swine industry. I will leave the details to my colleague, Dr. Peter Davies, here in the future. As we mentioned, my name is Dr. Heather Fowler. I'm the Director of Producer and Public Health at the National Pork Board. And so at the Pork Board, I oversee education and outreach as well as our research program in public health topics very broadly. I also facilitate our marketing department, so our kind of pork promotion piece in the swine industry and translating some of the science that we do, translating what does NAE really mean, what do we mean when we talk about medically important antibiotics, etc. So that's really what my talk will be about today. I'll take you through that threefold mission of the National Pork Board: research, education and outreach, and promotion, and show you what I do in those roles as it relates to antimicrobial stewardship and public health very broadly. For those who don't know, the National Pork Board was established under the Pork Promotion, Research, and Consumer Information Act, also known, often truncated, as the Pork Act of 1985. The pork checkoff, the little insignia here on my shirt, is actually a federally mandated donation, or contribution, I should say, from all producers, 40 cents per $100 value of hogs at the time of processing. And that collection is actually overseen by the USDA. So we're this weird quasi-governmental organization. We're not a not-for-profit, we're not a nonprofit, we're also not federal. But the USDA does oversee that. And again, I mentioned we have that threefold mission: education and outreach, research, and promotion. We are not allowed to influence policy or lobby at all. We cannot use checkoff dollars for that reason. And that's why we actually work with our colleagues, the National Pork Producers Council. They have their own checkoff. It's a voluntary checkoff that's used to act as an advocacy group, essentially, for the swine industry on the Hill. And then you have there, as this slide illustrates, we work really synergistically with the National Pork Producers Council. I did not create this slide, but I will give some edits back to the individual who did, and ask that they add the American Association of Swine Veterinarians. That's another organization that we work really closely with to address that threefold mission, to address the issues of our swine producers in the country. And so, as I mentioned, just going to walk you through that as it relates to antimicrobial resistance and public health very broadly. So when it comes to antimicrobial resistance, I believe in the One Health approach, and we are actually teaching our producers or educating them in that way, that antimicrobial resistance is very much a One Health issue. There are inputs that spread beyond those three, or across those three sectors of the One Health framework: human, animal, and environment. And also our producers every single day work with pigs in their barn or in their environment, and are conscious of the human health impact. So they are constantly thinking about people, pigs, and planet, right? They're producing food for people, and they need to make sure that's safe, and an environment that they need to make sure is sustainable so they can pass on to their next generations. And so this is just an example of one of the many infographics that we put together from time to time. We try to keep it fresh and put some new ones together. Let's see. There's a pig in that upper, your left-hand corner, my right-hand corner. That's actually from our strategic plan. Every 5 years we update our strategic plan, and then we put together a word cloud similar to the one that you just participated in. And if you zoom in, I can show you a slide a little bit later if you're curious, or actually I have some magnets in my purse if you would like one, that directs you to our website. It says people, pigs, and planet. And again, really just reiterating that One Health approach. And that really came out organically. I wasn't even at the Pork Board when that started. So just want to really point out that it is inherent within the swine industry and really in all food animal industries. So actually dating back, I don't have a slide for this, but dating back to the early 1990s, AASV, again, American Association of Swine Veterinarians, put out a judicious antibiotic use guideline for swine veterinarians. And remember, swine veterinarians are a part of the swine industry. They work very closely with our producers to make sure that they're using antibiotics responsibly. So you had that in the 90s from AASV. And in 2005, 2006, Dr. Liz Wagstrom, who is now MPP CDPC, and will be on a panel tomorrow, developed the Take Care, Use Antibiotics Responsibly program. This was a program directed at our producers to make sure that they were following the key principles to use antibiotics responsibly. Now, this program was a separate standalone program, separate from what many of you may know of as our Pork Quality Assurance Plus program, and this was actually created before it was Plus. It was just Pork Quality Assurance, or PQA. So in 2007, actually, this Take Care program was folded into the PQA Plus program. One of the reasons it became the Plus, it started off as primarily a food safety program focused on making sure that producers understood withdrawal times and were documenting antibiotic use for food safety residues, not resistance issues, right? And so when we added antibiotics, but also some guidance on animal welfare, that PQA program became PQA Plus. And so this slide just illustrates those 5 key principles that we try to enforce with our producers to think of each and every time they use antibiotics. We want them to overall try to decrease the need. So we talked about earlier those management practices, those animal husbandry practices definitely will decrease the overall need for antibiotics. We want to make sure that they weigh the advantages and disadvantages for each and every antibiotic use. Make sure when we use antibiotics that there will be a measurable benefit. Will it be curative? Will it actually treat the condition needed, or will it lead to other issues? Making sure that they document and have other management practices and share that with other farmhands, etc., to make sure that we're doing the right thing as it relates to antibiotics. And then also making sure that whenever we use antibiotics, that a veterinarian is included in that conversation. So making sure there's a VCPR in place. We also have other resources available on our website at pork.org/antibiotics. It's our antibiotic resource center. It has pamphlets. We also have magazine stories that we run from time to time in our pork magazine. But we use this website a lot, especially for new rules that were coming out. So for instance, the most recent one was Guidance for Industry 209-213 brought forth by the FDA. And we know with the FDA's 5-year plan that they just rolled out that there'll be some additional rules that we'll have to make sure that the producers are up to date, especially as it relates to those changes, and making sure that they're compliant. So I encourage you to check out that website, some of the fact sheets and things that we have out there. So again, just going through that threefold mission, moving forward to research. I've built in a commercial here because we can't be successful without academics like yourselves that may be in the audience submitting those proposals. When Dr. Niederwerder, is that how you say your name? I apologize, gave her presentation. Perfect. I immediately looked you up on our website, and we have funded some work by you, and so I'm really excited to see that. But we encourage you to go to our website, pork.org/research, and then subscribe. I've showed here a screenshot of the little subscribe listserv box, and that just makes sure that if we ever submit outside of our normal cycle, we generally have an RFP that we put out once a year at least, but there are times where we need something just in time. We need something like now or yesterday, so we'll put out an RFP. So I encourage you to subscribe, so that, and even tell your friends to subscribe. You can put someone's name in there. Name and email is all we really need to make sure that they get the RFPs, and they'll get it for all of our different RFPs across animal welfare, animal science, animal health, and public health. So in public health, very broadly, you can imagine the topic or the discipline of public health is very broad. And so my separation of those bullets is purposeful, because that's really, those bullets that as shown there are the ones that we cover in our RFP just about every year. But antimicrobial use and resistance is separated from the others in that it actually comes from a separate fund. So those, you can imagine, MRSA is very different than influenza and worker safety and health, but those proposals all actually compete for the same pot of money. And we've made that distinction because over the years, the industry, and it's our pork producers, this is pork checkoff dollars again that we're using to fund this research, and it's our producers that ultimately say where they want to put the money, where they want to invest the money. And so over over the years, our producers have really tried to focus in on antimicrobial stewardship. They realize that it's a timely issue, it is a public health threat, and that's something that we need to play our role in making sure that we address. And so you still see that in the amount of money that we've dedicated over the past decade, and even in the past 3 years. Each year we have just over $500,000 that we dedicate to antimicrobial stewardship type research. And what I mean by that is each and every year as well, again driven by our producers, that we have experts on that serve on our committee as well to help advise the producers and some of the nitty-gritty scientific details. But we go through and update our industry research priorities. So what are the things or the areas that we really care the most about? And I've tried to bold those key things here on this slide. So what that translates to is some of the research you can see here. As I mentioned, each year we have about $500,000, which really equates to only about $100,000 per project. So we're not funding those the USDA $1 million grants or anything like that, or NIH $1 million grants over 5 years. These are short 1 year, $100,000 grants. And as the director, producer, and public health, the person overseeing this work, I'm actively looking for partners and way to really leverage the existing dollars that we have. So looking at other organizations that may actually match research funding to make sure that maybe we can fund a larger study or multi-year project or bigger project. Right now, I should say that we're still doing meaningful research. We're just doing it in smaller chunks. So we're funding that scientific discovery, that proof of concept type work, not necessarily that translational piece, though that's something that we definitely look for in our RFPs. So this just shows you, again, some of the examples of the type of research that we fund. Again, looking at those alternatives to antibiotics, the impact of antibiotics on animal health and immunity, as well as really just tracking resistance genes and mobility. I should mention that was from 2018. We'll be making funding decisions in 2019 as that funding window has closed this October. So moving on to the last section, which is promotion. It's important to state that the National Pork Board, and probably not the best person to talk about marketing, besides the fact that, again, I more so translate the science to the marketing folks and kind of make sure that they understand the complexity and the nuance, especially when we talk about no antibiotics ever or medically important antibiotics. The thing that's interesting about that title is when you hear medically important, you just say, okay, let's just use the non-medically important. And you're like, oh, all 5 of them that, again, are not medically important. So they're not going to be very useful for treating actual disease. I don't have the slide here, unfortunately, but the FAO, WHO, and OIE got together at one point and said, okay, let's look at antimicrobials that are important for human disease, so human medicine, and then veterinary medicine. And you can imagine there's a lot of overlap, right? And then the non-medically important ones, or like our ionophores, for example, have some therapeutic effects in certain food animal species, but oftentimes not. So in terms of the promotion piece, the National Pork Board has switched to more of we call it a B2B versus B2C. We used to do a lot of communication, direct marketing from the business, us, the National Pork Board, to the consumer. You would have heard radio spots or gone to the meat case in your grocery store and saw that blue pork, we call it the pork pick, looks like a guitar pick. You may have seen that in your grocery store, and that's through our state associations and us directly reaching out to those organizations and helping them help us market directly to the consumer. Now we're doing more business-to-business communication. I should point out this is more food safety. One of the ways that we communicate directly to producers, to consumers, is through some of, this is actually a very wrinkled t-shirt, don't tell my mother, but I wasn't wearing it, so it's fine, that says 145 please. So it just speaks to the lower cooking temperature. In 2011, I believe, USDA lowered the cooking temperature for pork. And so it's okay to have your pork a little bit pink. So I wanted, again, second commercial break in this presentation, but really wanted to drive that home. But this is one of the ways that if we're volunteering, if we're working at a soup kitchen or something like that, we wear these shirts and we communicate directly to the consumer about food safety and modern pork production. Another way that we really, through our marketing, and I mentioned kind of translating for the marketing folks, is the NAE RWA kind of movement. So a lot of food labels. Talking about food labels is kind of a pet project of mine. It's a passion project. I was previously the Associate Director of Animal Health for the One Health Center for One Health Research at the University of Washington, and that was one of the projects I worked on during my time there and during my PhD. So I'm really big on kind of translating, what does this label really mean? Tell me more about it. And can I really tell from just a decal on a package of meat? Well, it was mentioned before, NAE, no antibiotics ever. Another phrase for that is raised without antibiotics. So at the pork board, we can't tell producers how to do things. We represent the entire industry. From the niche producers to our large conventional producers. And so if anything, we have put together a self-assessment tool that is still in draft, so this is the first time you're seeing it, and we're still doing some fine tuning on it. It was co-sponsored again by our colleagues at AASV to get producers to start to think, am I ready to transition to RWA? Maybe I've considered it for whatever reason, but have I really thought about what happens if I have a disease break in my farm? Are there opportunities to actually treat those sick animals, and making sure that animal welfare really is protected in those types of situations, making sure the veterinarian is involved in that conversation when they're thinking about transitioning. So these will be available, this form should be available hopefully by the end of the year, check back early next year, if not, definitely by March before the AASV convention, again for our producers to provide guidelines as they consider transitioning to RWA if they so choose. So I like to kind of end with the One Health framework, reminding us that that antimicrobial resistance is a One Health issue. We are here today talking about use in food animal species, which is just one section of that animal health chunk there on that pie chart. And at the National Pork Board, again, we have that threefold mission. We're really trying to do what's right for people, pigs, and planet. And that means making sure we're doing the appropriate research, translating that research, and sharing that research with our producers. One thing I didn't mention was working across the barnyard. So we're here with beef. There was that dig earlier about the white meat and beef being better than all the others. I disagree with that. But, we still work together harmoniously with our barnyard friends, and as well as academics. Again, you guys are the ones that conduct that research that help us make these scientific advances. And so I will end there. Thank you.